Today, we will be discussing keratoglobus, a rare condition that affects the cornea of the eye. We will cover its causes, symptoms, diagnosis, treatment options, and impact on patients. Let's start by looking at how it differs from similar conditions like keratoconus. Keratoglobus, keratoconus, and pellucid marginal degeneration are different corneal ectasias with unique characteristics. Keratoglobus involves globally enlarged and protruding cornea, keratoconus has localized conical thinning, and pellucid marginal degeneration affects inferior crescent-shaped area. Accurate diagnosis and treatment depend on recognizing these differences. Keratoglobus is a condition with strong genetic component. Mutations in collagen genes, namely COL8A1 and COL8A2, disrupt corneal structure and transparency, leading to thinning, enlargement, and instability. Understanding these mutations helps unravel its pathophysiology and potential treatments. Keratoglobus is a condition characterized by reduced vision, high refractive errors, irregular astigmatism, and thinning of the cornea. Diagnosis is made through careful examination and consideration of symptoms and family history. In this section, we will learn about advanced techniques used to assess corneal topography and map irregular astigmatism in patients with keratoglobus. These techniques, including orb scan, pentacam, and Placido-based topographers, provide detailed measurements of corneal shape, including elevations, curvature, and thickness of both anterior and posterior surfaces. They also create color-coded maps that show the distribution of corneal power, thereby helping clinicians understand the irregular astigmatism in keratoglobus. This knowledge is important for creating personalized treatment plans and accurately monitoring the progression of the disease. Keratoglobus gradually worsens over time, causing increased nearsightedness and astigmatism. The thinning cornea is vulnerable to sudden swelling and vision loss. Regular monitoring and early treatment are important for managing visual impairment. Corneal biomechanics, exploring the biomechanical properties of the cornea and their role in the development and progression of keratoglobus. Corneal biomechanics play a significant role in the development and progression of keratoglobus. The cornea acts as a mechanical barrier and contributes to its shape and optical properties. Alterations in the collagen structure and composition affect its viscoelastic properties, making the cornea more susceptible to thinning and bulging. Understanding the biomechanical changes in keratoglobus may aid in developing novel treatment approaches targeting the underlying mechanical instability. The surgical management of keratoglobus involves utilizing advanced techniques such as corneal crosslinking, intrastromal corneal rings, and corneal transplantation. These procedures aim to strengthen the cornea, improve its shape and stability, and ultimately achieve better visual outcomes. The choice of surgical approach depends on the severity of the disease and the individual patient's specific needs. Visual rehabilitation for keratoglobus patients involves using specialty contact lenses, like scleral lenses and custom soft lenses, to correct irregular astigmatism and improve functional vision. Low vision aids, such as magnifiers and telescopes, can also help patients with residual visual impairment. Close collaboration between ophthalmologists and optometrists is important for successful visual rehabilitation. In the section on complications and prognosis, we discuss the potential risks associated with surgical procedures for keratoglobus. These include corneal haze, refractive changes, infection, corneal thinning, graft rejection, and postoperative astigmatism. Preoperative evaluation and patient counseling are crucial for optimal outcomes. Long-term vision prognosis varies and requires careful monitoring. Research advances, highlighting recent advancements in the field of keratoglobus research, including gene therapy and regenerative medicine. Exciting research endeavors are underway to further understand keratoglobus and explore potential therapeutic options. Genetic studies contribute to identifying novel mutations, elucidating disease mechanisms, and paving the way for gene-based therapies. Regenerative medicine approaches, such as tissue engineering and stem cell therapy, hold promise in restoring corneal integrity and function. Collaborative research efforts worldwide aim to advance knowledge and develop innovative treatments for this rare condition. Case studies, analyzing detailed case studies of patients with keratoglobus, focusing on management strategies and outcomes. In-depth analysis of case studies provides valuable insights into the management of keratoglobus. We will explore various patient profiles, including disease severity, treatment selection, and postoperative outcomes. This comprehensive approach allows us to understand the practical challenges faced by clinicians and the impact of different therapeutic interventions on visual rehabilitation and quality of life. Case studies play a vital role in enhancing our clinical decision-making process and improving patient care strategies. Impact on quality of life, assessing the psychosocial and functional implications of keratoglobus on patients' daily lives. The impact of keratoglobus extends beyond ocular health, affecting patients' overall quality of life. Visual impairment, limitations in daily activities, and the need for ongoing medical intervention often lead to emotional distress and reduced social participation. Understanding the psychosocial implications of keratoglobus helps healthcare providers develop comprehensive patient-centered care plans, addressing not only vision-related concerns but also the holistic well-being of individuals living with this condition. In conclusion, keratoglobus is a complex corneal condition with various clinical presentations and management options. As future ophthalmologists, it is essential to understand this rare disease to provide optimal care and contribute to ongoing research.